All right. Well, good afternoon, everyone. This is Bariatric Friday, American Surgery Center. My name is Kemal Erkan. I am here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing good, Kemal. Thank you very much. It's great to be back on Bariatric Friday. I think we've missed a couple of sessions, right?
Last week was my fault, but we were on the week before.
Yeah.
So we are, and actually there was a Thanksgiving before that.
That is correct. Yes. Yeah, I knew it was a couple of them. Yeah.
So, but it's all good otherwise.
No, absolutely.
So now we are gonna discuss going through the holiday seasons without gaining 10% of our body weight. So
yeah.
that would be 18 pounds for me, right? So not really, but our patients who are going through the program, they may be struggling with this the most. We want to make sure that we give them some guidelines and support them as much as we can from our side, so that they can actually have a good maybe preparation, understanding of what's happening and what needs to happen. So we have our 3 patients who are going through the program. They will still have they still have some time to get to the surgery, but the time that they're most struggling right now is between Thanksgiving and Christmas and New Year. Food everywhere. We have access to food, office, home, wherever you go, there are cookies, chocolates, drinks, and this is already a struggle for many of us, and we are also struggling with this personally. But if I were to go through, if I was at BMI 47, how would I actually deal with this, right? So this is a little bit more difficult time. So, and I was hoping that Dr. Erkan would actually give us some guidelines and some guidance so that we can actually help our patients to go through this process.
Absolutely. This is obviously good timing for us to talk about this, Kemal. So although bariatric surgery is really the most effective treatment we have for morbid obesity right now, morbid obesity being defined as obesity which is out of control, people who are at least 100 pounds over their ideal body weight, or who have a body mass index greater than 40 or sometimes even greater than 35. Definitely bariatric surgery is the best treatment we have available right now. Having said that, even with bariatric surgery, patients can still struggle with weight regain because, as we've said many times in this session, obesity really is a biological problem primarily. And even surgery does not fix the biology, essentially. The biology, which is the tendency for the body to prefer a higher weight, will still be there. So if we allow it, if we let go, essentially the weight could creep back up. And holidays is one of the danger times from that point of view. It's interesting, Kemal, that when we talk about holidays, all of us really goes through the same issue, right? We pick up a few pounds and then we have to go back and try to lose them. And one of the best things you hear from patients very often is, hey, for the first time, I lost weight during a holiday, after they've had surgery, just particularly early on. Having said that, we talk about the danger of, letting go. Clearly, holidays are a time of celebration, as you mentioned. It's a time for us to gather with family, with friends, and obviously, culturally, one of the important focus of celebration is food. So there will be a lot of food, and not all the food is healthy, as we know, right? So we have to be prepared mentally, and we have to give some kind of hints and some kind of suggestions really for patients to try to avoid falling into that trap. So the first and most important thing, I believe, Kemal, is to be aware that weight gain could happen during the holidays. So if you prepare yourself with that mindset, I think you are already ahead of the game. You're not being caught by surprise, essentially. So there are going to be many parties. There are going to be many gatherings where there will be a lot of food. So how do I prepare myself? How do I, first of all, think about when I go there? Well, there are a few things that you could do. For instance, avoid going hungry, right? If you haven't had any food and you're going suddenly into this party where you're going to be distracted with social mingling and talking and other things, then you may not be aware how much you might be eating at that time. So you have to avoid going hungry. That's really important. So try to eat something before you go, right? And then another thing is, take a friend with you that can hold you accountable. Somebody can watch out for you and say, hey, we are going to watch out for each other. We're going to try to stay disciplined, and that kind of preparation may help as well, right? And sometimes, particularly when you are going to a gathering where people are bringing their own food, you should bring the foods that are going to be most helpful to you with you, not the foods that you struggle with, right? So bring healthy stuff, healthy snacks, which is mainly vegetables and proteins, so that you can focus on those when you are, when you're eating with others. So those are preparation mindsets that could set you really for not failing when you are going to those parties, essentially. And then, of course, we can talk, what do you do when you are at the party? What kind of strategies can you use to minimize being caught in a situation where you're overeating?
So let's actually, let's put it in perspective so that people can actually follow. So when we go through this process, and we are not just talking about our patients only. This applies to all of us. And perhaps I repeated this in the other sessions for the same topic before, but because holidays are happening every year, so maybe we should actually go every 3 years, so then we don't have to deal with it every year. So maybe not, but last Friday was our holiday party for United Medical and CHRIAS Surgery Center and United Medical Clinic.
It was a fantastic party, by the way, Kemal.
It was.
Really well done. And kudos to the people who really prepared and organized it. And we'll probably one of the best Christmas parties I've ever been, to tell you the truth.
Well, and we'll be very happy to hear that. And there were a couple other people helping, but it was mainly that was her show. So, and I really do appreciate that. But we knew that we were going to have drinks and food in this place. So the party starts at 7. So one of the habits that I started having since this COVID weight gain, actually, I'm still struggling, but personally, like I still didn't lose this extra 20-25 pounds that I gained. And I'm more careful around these times. So I knew that I was going to eat more than what I would. So then I start preparation earlier mentally. But then one of the things that helped me the most is having like egg whites. So because if you're going to have a couple of drinks, you don't want to be empty stomach. So then the egg whites are, I had 3 of them, and it held me up for the whole day, all night. Now, can our patients who are going through the program, would that be enough? Would that hold them up as much as it would hold me up?
Oh, absolutely. Absolutely. In fact, it may hold them up even better, Kemal, because remember, our patients do have a much lower volume of stomach, regardless of what procedure they've had, whether they've had the sleeve gastrectomy or the gastric bypass, or even if they are band patients, remember the stomach that receives the food volume-wise is a lot smaller than the original stomach. So, in fact, that may be one of the questions people would have and say, well, how can you overeat if you've had bariatric surgery? Well, essentially, the issue is not really eating a lot of volume at once. It's eating small amounts frequently, right? And also choosing foods, perhaps, that have more calorie per volume than other foods, right? Mm-hmm. So those would be the sweets, for instance, right? That would be a major issue, right? If you're eating a lot of sweets or a lot of carbs, as opposed to eating vegetables, as opposed to eating protein, where potentially the calorie amount is small per volume, essentially, right? So yes, absolutely, the preparations that you are suggesting would work very well, because you are going to a place where you are still going to enjoy the company of others, but then you are not going to be struggling, essentially. But what other things can they do, Kemal? Okay, well, for instance, remember with, for instance, the setup we had for the party, there were stands where people had, access to a lot of food, right, for the buffet, right? So if you are going to be hanging around those tables most of the night, you are more likely to be picking from that food, right? So what you could do consciously is stay away, stay in a corner of the room, for instance, where there is no food near you, right? Because if you're gathering around and you're standing and talking with people, and then the food is right by you, then the temptation for you to pick from that food is much higher. So consciously understand the positioning of the room and stay in an area where you are less likely to do that. So that's one small thing, right? Another thing that you could do, obviously, is when you are going for the foods, instead of following the pattern that they have laid out for you, where you're going to take out most of the stuff, you could selectively fill up your plate with things that have less calorie first. So your plate physically does not have any more room for the things that you don't want to have, like the carbs, for instance, or the sweets later on, right? And then the other major, obviously, the issue that we have talked about, but we obviously have to mention here, is alcohol, right? And alcohol, we had a full session in the past about, what is our stand on alcohol, right? And we talk about the fact that alcohol is empty calorie, alcohol increases appetite, right? And so there is a danger with alcohol as well. And of course, the other big thing with alcohol is that, if you've had bariatric surgery, it takes much less alcohol for you to become drunk than otherwise, right? And then if you are drunk, you are less likely to be focused on what you should be doing. So the alcohol situation actually can worsen, right? Now, that mean you cannot have alcohol? No, it just means that you have to be careful. And then if you are going to have alcohol, avoid the mixed drinks, the ones that are likely to have a lot of soda, fruit juice, and other things that will have a lot of calories. So all these are preparations that people can do, Kemal, to minimize the risk of being overindulgent at during the holidays, and therefore gain weight.
Now, I think maybe just to kind of separate the patients who already have bariatric surgery versus patients who are going through the process to get the surgery. Well, our patients who have gastric sleeve or gastric bypass, if they already have this, they're going to be already kind of prepare for these types of things, because they're going to be less hungry anyway. So I think it's a little bit easier for them in a way that at least the hunger won't be there as much, versus patients who aren't going through the process. We don't want them to gain weight. So some of them, they're already kind of delaying the process because of the either right before Thanksgiving or right before Christmas or right before New Year. So they already kind of delayed. Now they have a little bit longer time to get to the surgery. So I want to kind of maybe kind of focus on those patients who are not done with their surgery, who are going through the process. So because they now have the problem of hunger, right? So we have some bad habits to get there. Like not all of them are about the habits, but that's already there. So like if my stomach is going to tell me that I'm hungry or more hungrier, then I'm going to be struggling when I have food all over the place. So that's why I was thinking that for those patients, is there like some small meal before you go to the party? Would that be like the most ideal? What do you think?
Absolutely. I mean, all those are strategies that are good. They will work for both, right? It's about the preparation, right? But more importantly, even Kemal, the patients that are preparing for surgery, we do not want to be in a situation where, people are going to be relaxed because they're going to have surgery anyway, right? I do remember many years ago, a young gal came to our office. I think she was about 20. She came with her mom and for surgery, right? And she definitely was a candidate for surgery. And as we were preparing and talking, she showed up a few months later. This was before the time we had the focused case conferences like we are having right now. And she had gained 60 pounds. I was shocked. I said, what happened? Well, her answer was, I'm going to have surgery anyway, right? So that was her mindset, right? So it's very important as we educate our patients to make sure they understand that, gaining weight through the process actually is sometimes that could hurt their chances of getting authorization from the insurance companies, because many insurance companies actually penalize patients for gaining weight. Now, we as a program, obviously, we're not there to penalize, right? But also, we want our patients to start having a lifestyle really that will be implemented even before surgery, and it will be the chance for them to really implement that lifestyle is higher if they start even before the surgery to think this way, right? So I'm going through bariatric surgery right now. I am preparing. There is a holiday party. Should I be careful? Of course, you have to be careful. And what would be the things I need to do? And obviously, we're talking about them, right? So that avoid going hungry, have a friend that can hold you accountable, and you may hold them accountable as well. And then all these little strategies that we're talking about being conscious of the fact that the setup in a holiday party is there for you to overeat. And then obviously, we don't want that to happen. And the whole reason we're talking about that essentially is because holidays are about food, right? Particularly the way we celebrate them, right? And it's not only by going to a Christmas party like the one you and I went to, the fantastic party we had, but it's also, in the office, in any communal gathering, in the neighborhood. It's all about getting together, reconnecting with friends and families. And what is the central theme in all these reconnections is the food. So we all gather around the food, right? Well, it's good. We're celebrating. We're offering to friends and they're offering to us. But obviously, when we eat too much, then that becomes a health hazard. And that's why we're here, right? We're talking about obesity, and the primary driver of that is because we're eating too much. And there are a number of reasons why this is happening, because the biological drive that we have also is that our body, instead of using the energy source that we have, even when we have excessive energy, we are still hungry. But sometimes there is, mental hunger as well that we don't talk about, Kemal, right? Sometimes we are full, and yet we have this compelling reason for us to eat. We have to recognize these situations, because if we don't, then obviously we're going to fall into the trap.
So I think, as we discussed in some of our other events, the celebration and getting together and celebration is the focus, where the food is the centerpiece, and we are trying to please each other with food. These are all, part of the issues. And I was thinking that, and we use this for our diabetes program too, where this is not just one person issue. And then you mentioned a couple of times having someone with you, but even, not just for the holiday time, Dr. Ergau, I was thinking even for the times that are like any other time, like if household members are not educated about what the person is going through, it's kind of like an education or being mindful for the entire family, so that you don't have some people in the household just there eating like cookies and ice cream, and they leave it right there, and then it's available to you. So then I think this is also kind of like the entire household really needs to be more aware of this. And I think that's one of the things that we are maybe sometimes missing.
Yes, we actually do encourage, as family members to really be part of the process, right? Kemal, for instance, very often when patients go to nutritional counseling, or when they go through the process themselves, they ask us whether they are okay to bring a family member, and I encourage them to do that, right? Because that support is important. First of all, in principle, the support is critical, because if you have somebody, if the spouse, for instance, is not supporting the fact that their partner is going through the bariatric process, that could be an issue, right? Because then, as you say, then obviously they could sabotage them, or even without knowing, they could do things that would really interfere with their chances of succeeding afterwards with surgery. So making sure that there is enough support, and understanding within the family is very, very important. When that happens, what we hear, Kemal, is that the changes that the individual makes during their bariatric process and after surgery are actually influence the rest of the family as well, right? Because once they see that that person is making good choices, others will follow as well. Once they see that that person is actually having good results, others are likely to follow as well. So it is not unusual for us to hear, for instance, patients telling, hey, my partner also started losing weight since I've started this process, or my children also have started eating healthy since I started this process. So yes, clearly this is a family affair in a way, because we do live with other people, Kemal, and their support and their and their understanding is critical for our success. There's no question about that.
No, that's very true. So in terms of the exercise and walking, because holiday seasons are also kind of like the time where the weather conditions are not the most ideal. Any suggestions on the physical activities?
That's actually a great point, Kemal, because essentially that would be another way to try to counter the potential overeating, right? So if you have a certain exercise regimen, that you adhere to, maybe you want to wrap that up at the time of the holidays, right? So as you said, if you're used to going to the gym and you were going, 3 times a week, now maybe you should go 4 times a week. If you were going to the gym and spending half an hour, maybe now you should do 45 minutes. So in other words, increased physical activity is a way for you to try to counter the fact that you're exposed to more calorie consumption during the holiday time, right? So what you want to do essentially is start the holiday season at a certain weight, and then once the holiday season is over, at the very least, your weight should be the same. The one thing you don't want is for the weight to be up. Of course, if the weight is down at the end, kudos, right? Because that's a great achievement. But we don't want the weight to move in the wrong direction during the holidays. And all these tips that we are providing about getting prepared mentally, increasing the exercise, having strategies on how to deal with the exposure to food during the holidays, all those are geared to the fact that the holiday is a time of celebration, but it's also a time of danger for us, because that's a time when we are likely to pick weight up.
So, in terms of going through the process, so as you remember, Denise and Patrick and Karen, right? So is any of them more vulnerable than the others for this process?
I don't think so, Kemal. I think they're all vulnerable, right? So one thing that is clear, Kemal, and that's something that is really obvious, but not really obvious. When people, when you talk to people about this, is that once a person's weight is at a certain high level, right? For instance, a body mass index greater than 40, a weight that is at least 100 pounds over their ideal body weight, it is a lot easier to gain more weight from that position than it would otherwise be from a lower weight, So for a person who has a normal weight, for instance, it's actually not very easy for them to jump 10 pounds, right? It would require some really indulgence and some inactivity for that to happen. But for a person whose weight is high to begin with, let's say a body mass index over 40, gaining 10 pounds actually would be a weekend affair, right? On a weekend, they indulge it a little bit and suddenly the weight is 10 pounds higher, right? So they are all in danger of that. But what is also critically important is once that 10 pound, that 15 pounds comes on, it is very hard to bring it down from that, right? The whole point about the whole reason they are struggling with obesity, Kemal, is because their body treats weight gain and weight loss unevenly, right? They're not equal. They're not treated equally. Weight gain is much more favored than weight loss. And that's the whole problem, right? So you can gain 15 pounds over a weekend, but it may take you 3 months to try to lose that, right? That's the whole point. So all our patients are in serious danger for this, right? And we've seen this through COVID, right? Weight gain, right? We've seen this with holidays. We've seen this when people have personal crisis, right? Suddenly 20, 25 pounds. So obesity begets obesity. Obesity by itself is a platform for more obesity. Obesity by itself is a danger for more obesity. In other words, if you're obese, you're in danger of becoming even more obese, much, much more easily.
We see that in our returning patients with
absolutely.
First consult and 42 BMI coming back with 45 BMI 6 months later. So
yeah. So people say, why do I gain weight so easily? Well, because your weight is so high. And when your weight is that high, it's much easier to gain weight than it would otherwise be. There are biological switches, Kemal, that make it a lot easier for people to gain more weight once they reach a certain level. That's why we're saying, you know what, you should consider bariatric surgery once your weight gets to this level, because not only you're in danger of all these diseases, but you're in danger of continuing to gain weight for the rest of your life.
So, one other, going back to the maybe physical activity, and sometimes I think we try to fix things, while we are trying to fix things, we forget some of the basics, fundamental basics, like the physical activity. Like right now, I'm in my office, and if I'm here all day long and the position that I'm sitting, my body circulation, blood circulation is not the most ideal. So when you are in the surgery center, you are not sitting. Or when you are in the office, when you don't do telemedicine, you are not sitting. But the office people, we are. So that means we have to make extra effort. We have to show extra effort to do these activities. Because
absolutely.
Recently, one of our people who was actually talking about certain issues she was having, and after I listened to her for 10, 11, maybe 15 minutes, she tells me a lot of problems with what everyone is trying to do for her. And I'm like, well, how about the exercise? How are we doing with the, do we have any, sports, fitness, walking, which is one of the best? None. So we are trying to, while we focus on fixing the problem with other things, we forget the basics. So I just want to make sure patients do put that special effort, especially this is a big change, which requires change. Like you can't just do what you were doing before. That's not going to be well, yes, we'll take the half of the stomach, but it's going to get bigger if you don't change anything, right? Mm-hmm. So this commitment is there's a contingency. So you have to make these lifestyle changes. We can take care of the chronic care issue, the chronic illness problem, but if we don't do anything on the other side, that's not a magical fix. It's not going to happen. So I mean, we talk about this. This is for all of us. I mean, I'm not happy with my weight since April 2020. Since I got COVID, there was time where I didn't have, how much I ate. So my exercise it was lacking in 2020 and maybe some part of 2021. And like we are behind. So now trying to actually get back and then losing that weight now is more difficult than it was maybe 3 years ago. So that's why we kind of need to really understand what it is that's causing the problem, and between the surgery and the making modification in our lives, then it's going to take us to the ideal situation. So
we actually, Kemal, we have the technology nowadays, right, to track our movement, to measure our activity, right? Our smartphone, smartwatches, they track our movement, right? And the issue here is there has to be movement. There has to be more movement in our life. The foundation of movement is walking for human beings, right? Walking is the foundation of movement, right? And we can track how much we walk nowadays, right? So if we tell, that's right, exactly. So it tells you exactly how much walking you've done over a period of time, right? So let's use that. Let's use our smartwatches, our smartphone to track that. Every night, let's look how many steps did I walk today? Yes, I have a sedentary job, right? But what effort did I make to change that? What effort did I make that to modify that, right? So if you start looking on how many steps you walked every day, you can start tweaking your daily living to add more steps, whether it's parking further away, whether it's taking the stairs as opposed to the elevator, whether it's purposely going for a walk during your lunch break, or whether it's purposely getting out from your chair and doing a few steps when you're during your work day. All these little things will add steps. So what is important about that? Well, because at the end of the day, you will have walked more if you do all these things. But then the other important thing, Kemal, is that—
If I may just share this, Dr. Gut,
because
I was just looking at the November 2020. My average daily step was 3,900. This year it's 71. It's like it doubles. Last year it was 68. That means between last year versus this year, the main problem was in 2020. And in April, I was at 2,300 in 2020. That's the time when I got COVID.
Absolutely.
So now we are at 7,100. So this requires a little bit more planning. Like today, from 8 to 12, I had 4 meetings, and then I had only 20 minutes in between the meetings. And that 20 minutes, Joshua and I, we just run out, and that gave me 1 mile that I wasn't going to be able to catch up otherwise. So it requires certain planning, and this is kind of this, gaining new habits and maintaining these habits is kind of maybe the key, and this requires more effort. So it's not just happening.
Yes, but the trade-off also, Kemal, is that every extra step that you took is not only the extra step, it also means that you were sedentary less, right? So that's the trade-off, because you cannot sit and walk at the same time. Every time you're walking, it means you're sitting less. So that's the big trade-off here, right? So moving as a foundation of all our activity is very important. And now we have the technology to measure that. Let's track it. Let's look at it every night and see how much movement did I do today, whether it's a smartwatch or a smartphone. In fact, if you don't have a smartwatch, I would say, maybe this should be your wish for Santa this year to get you a smartwatch, because it's really wonderful. You're less likely to leave your smartwatch behind as opposed to your phone, and that can track your movements all the time. And if you look at it every night, you will figure out ways to increase that activity day in and day out. As I said, you could park further away, or where you are in a store, you could try to take the longest route to go to an aisle as opposed to taking the shortcut, which is what we do usually.
Well, for those who are local in Newcastle County, at least, Christiana Mall, like from one end to the other, is more than a mile. If you're not able to walk outside, and if you cannot afford a gym membership, which I don't buy that, but because we can, everyone can, and even these days with the Medicare Advantage program that we have, they actually have incentives for patients with the gym membership and other things. So, but you know what? Maybe going to mall and just take 2 rounds and then get yourself 2 miles. That's not a bad thing. But you don't want to do that in the hospital because some hospitals, they're also kind of big, right? Yeah. So, but I think again, the commitment to the change and adopting these habits and maintaining them is going to be the key. And otherwise, we are going to have the same issues every holidays. Now, unless we change the holiday rule to the every 3 years, then this is a yearly problem.
No,
So,
we need our holidays. Come on.
okay, so we'll keep the holidays. Now, next week, we'll be back with, you're here, right? Next week we are.
No. I'm
So
away
next week
for
we are
the
off. The
World Cup
following
final.
week
Yeah.
is the Christmas Eve, I believe, or so the last day to the Christmas. So we may be on or off. Not sure yet.
Yeah.
But I think we can still make it for that one. But Dr. Irgau, this is as usual. This is important and always fun to share these things with our patients. Now, one other thing that I want to mention: we do say our patients, but this is an issue with the society itself. This morning, one of my meetings was with one of the insurance companies where the understanding of morbid obesity discussion came up, and I realized how much we advance as United Medical ACO, CHRIAS, and Surgery Center as a program, and our providers, their understanding and their approach, and therefore our patients' benefit is at a little different place. So we'll keep keep doing what we are doing, and we'll try to make it better, and hoping that everyone can benefit from what we are putting out there, and hoping that no one gains any weight and will be healthier and live a long life. We'll plan to see you guys before the end of the year, but if not, happy holidays, Merry Christmas, whatever you are celebrating, enjoy, and we'll see you soon. Bye-bye.
Take care. Bye-bye. Thanks, Kemal.